Nurses Day was celebrated locally and globally on May the 12th under the theme Nurses, a Force for Change, Care Effective, Cost Effective. Now, this is a day when nurses globally reflected on and celebrated the meaning of their value, of their contribution in healthcare delivery. So today we reflect on the state of nursing in South Africa. We'll first unpack all the challenges facing nursing today, from training to nursing care, and then map the way forward. Now, we have an expert panel of guests that include nurses from the public and private sectors, the health ministry, the nurses regulatory body, and the labor union. So grab a cup of coffee or tea now, sit back, relax, and learn from this exciting show ahead. And for any questions or views on this topic, please call us on Johannesburg 714-6843, 6847, or 6857. Or interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk, including, of course, our email address, healthtalk@sabc.co.za. I'm Dr. Silla Mutaung, and this is Health Talk.
On 12th May 2014, Nurses Day coincided with the celebration of the 20 years of democracy, which the nurses were part of and aligned themselves with. Soon after democracy, nurses have formed a democratically elected nursing council, which aligned itself the legislative framework to assist nurses to meet the demands of a health system in transformation. South Africa's predominantly nurse-based healthcare system requires nurses to have the competence and expertise to manage the country's burden of disease and to meet South Africa's healthcare needs.
We have to be models of what we are implementing now.
Globally, there's a recognition of a healthcare workforce crisis, characterized by critical shortages, imbalanced skills mix, migration of health professionals, insufficient progress on the Millenium Development Goals, and millions of people without access to health services. Given that nurses make up the largest single group of healthcare providers in any country, including South Africa, the human resource for health crisis can also be characterized as a nursing crisis.
Nurses today say, we are just nursing for the cemetery. But if you just then look at the big picture and see this is too much, we are drowning, then you drown. So you have to keep your head above water.
The South African Minister of Health, Dr. Motsoaledi, appointed the Chief Nursing Officer to facilitate the implementation of a strategy to deal with training and practice for nursing. The South African Nursing Council has realigned the scopes of practice and is busy transforming nursing education at all levels using a consultative process with relevant structures. One of the strongest and most urgent recommendations is the need for nursing colleges to be declared higher education institutions in compliance with the provisions of the Higher Education Act, which was amended in 2008. We can argue, and probably should argue, that ethics teaching must move from principle-based ethics to virtue ethics. But we also have to acknowledge that there is a need to improve the psychosocial and physical working environment of the nurse before we can realistically expect a change to occur.
Right. The critical shortage of nurses in South Africa has serious implications for implementation of the nurse-dependent NHI, or National Health Insurance System, and of course in our ability to reach the Millenium Development Goals, or MDGs for short. Now, let us understand why and more from our guests. And first up in our Johannesburg studio, we have Dr. Nonhlanhla Jabu Makanya, who is the government's Chief Nursing and Midwifery Officer from the Department of Health. And for the purposes of this show, because that's a bit of a long one, we'll just call you Chief Nursing Officer, if you don't mind. And next to her, of course, we have Maditapo Masemola. I could say Sister Maditapo Masemola, but she prefers Maditapo Masemola, who's the Acting General Secretary of DINOSA. And in our Durban studio, we have Professor Busisiwe Rosemary Bengu, who's the chairperson of the South African Nursing Council. Professor Bengu in Durban, welcome to Health Talk. And the two ladies in our Johannesburg studio, welcome to Health Talk.
Thank you.
Now, we were celebrating International Nurses Day recently. Perhaps let's start with you, Maditapo. What is the significance of this day?
The significance of the day is for nurses globally to remind themselves of the oath that they've taken, what they stand for in communities, and also to say what is nursing's stature generally. So that as nurses, we appreciate, and everybody else appreciate the work that nurses do globally, because they are the largest health professionals within the health system.
I see. Now, Dr. Makanya, all right, this position of chief, let's call it chief nursing officer,
yes,
is a fairly new one, and I'm told that this was somewhere around 2011, that it
2014.
2014. First of all, just tell us about the position itself. I mean, what is the role of a chief nursing officer within the Department of Health? Because not too many people know about this.
Thanks. The concept of the chief nursing officer is an international concept in terms of nurse leadership.
Right.
And it's well established globally. It has not been accepted in South Africa, and we're quite encouraged when our current Minister of Health listened to the nurses and established this position from January 2014. And I'm the first incumbent of the chief nursing officer position for South Africa. The responsibilities for this position overall is to advise government on how nursing and midwifery interventions can contribute to the improvement of the life of the population for South Africa.
Now, I mentioned earlier in my introduction that, the critical shortage of nurses, has an impact on our ability to reach the MDGs. Now, your comment in terms of the role that nurses play in that aspect.
Nurses in South Africa has played quite a significant role in terms of achievement of the 3 health-related MDGs. And that is quite evidence in terms of when the role of a nurse was revised, probably, let me put it this way, the actual active response, country's response to HIV actively started in 2009, which is almost more than 10 years. So we were lagging behind, from other countries. And that has had major impact in terms of achievement of health-related Millennium Goals, because the 3 are also, or any achievement is kind of compounded by the impact of HIV, both on maternal and child health services and on the general population. Nursing interventions in terms of making a difference. You know that when WHO introduced a new concept where nurses were allowed to take on new responsibilities, develop new competencies so that they can be able to initiate treatment of ARVs, there was significant reduction in terms of mother-to-child transmission. There was improvement overall of the what do you call it? The not longevity, what do you call it? Life expectancy. Right. I'm sorry. Yeah. There was general improvement in life expectancy because of accelerated rate in terms of HCT, where nurses played quite a significant role. So the examples in terms of focusing on nursing and nursing interventions have actually bared useful fruits in the area of HIV, and we are looking into taking those into other areas of the MDGs.
All right, okay. Let me take this opportunity then to cross over to our Devon studio and speak to Professor Bengu. Now, Professor Bengu, you've listened to the introduction and the comments from the 2 ladies here, Dr. Makanya and Masemolo Maditapo. Now, from your perspective, first of all, perhaps before I ask you for your view on the role of nurses in South Africa today, just briefly tell us what the role of the South African National Council is in the current dispensation.
The South African Nursing Council is to protect the public, and it does so by ensuring that the nurses are competent and ensure the safety of the healthcare users. That's the reason why we have so much to do with nurses, is just to ensure that they make sure that the nurses, the healthcare users are safe in their hands.
And how do you see the role of nurses in the current situation?
Well, as the CNO has indicated, the role of nurses has been expanded, and due to the burden of disease that has been increased by the HIV and AIDS. But at the same time, the non-communicable chronic diseases are also on the increase. So the nurses are, since the shortage of doctors is a problem, the nurses are always come to the party, and that is done through shifting the tasks of the already functions that are done by doctors to the nurses. Like she has indicated that they are already initiating treatment for antiretroviral treatment, and they are also prescribing under general circumstances medications up to Schedule 4. In fact, nowadays we've had pressure from specialist nurses, especially in midwifery, advanced midwifery, psychiatry, and palliative care, who want to actually have that authority increased to bigger schedules, like higher schedules, like they need to prescribe pain control for women in labor, for patients in the process of dying, the palliative care nurses, and also the psychiatric nurses wanting to prescribe antidepressants for their patients, since they are allowed to have a private practice.
All right, maybe let me come back to our Johannesburg studio here. I mean, whilst we celebrate, nurses in South Africa and so on, the reality is that there are problems, or if you like, there are challenges, whichever term you like. And one of the main ones is shortage of nurses in South Africa. Let me get a perspective from Denosa. What do you regard as the current challenges facing the nursing profession today?
I think one of the greatest challenges that are still facing us, that have been with us for a very long time in the nursing profession, is shortage of health professionals or of nurses. You can talk about shortages based on either you say there's no nurses totally or maldistribution of nurses when you look at rural vis-a-vis urban areas. And this is caused by the fact that nurses in their own right also go for places where they think that there are opportunities.
Right.
And I think even with the research that has been done by International Council of Nurses for this year theme, they've realized that when we look at South Africa, there will be 39.3 nurses per 10,000 population, but predominantly those nurses are predominantly in private sector. And when you look at private sector, it's saving only 17% of the population.
Okay. I think on that note, maybe let's just hold it there, because I'd like to come back to the issue of, whether or not we're training enough nurses and so on, but that after the break. So let's go for a quick commercial break, and when we come back, we examine issues around training of nurses. Please don't go away.
Your World makes it its business every evening to round up the leading local stories and international news to keep you informed all the time.
Make a date with Your World every evening for all the news headlines around the world to keep you abreast with knowledge.
Catch Your World for headlines across the world every Monday to Friday from 9 p.m, then Saturday and Sunday from 7 p.m. This is Primetime News.
Scores have been evicted after their properties were sold without their knowledge.
We take an in-depth look at top stories of the day. Live crossings to our journalists on the scene. Studio analysis. And a special focus on regional stories. This is Primetime News, weekdays at 6:30 p.m. and weekends at 6 p.m. on the SABC News channel.
Now, some sources believe that one of the largest contributing factors to the shortage of nurses in South Africa was the government's closure of a number of South African nursing colleges in the 90s. Is that true? And do we train enough nurses? Well, let's find out from our guests. In our Johannesburg studio, we still have Dr. Makanya, but are now joined by Mr. Dina Naidu, who is the Group Services Director from the Landmed Health Group. Dina, welcome to Health Talk.
Good morning.
And of course, in our Devon studio, we still have Professor Bengu. Now, let's start with you, Dina. Perhaps just explain to us what your role is within the Landmed Health Group.
Firstly, I just want to take this opportunity to wishing the nurses internationally throughout the African continent and in South Africa, Happy Nurses Day.
Right.
I think their value, their dedication and their commitment is greatly appreciated.
Right.
So my current role at the moment is to drive nursing strategy, and part of that strategy is a big focus on training and development and trying to improve the competencies in terms of the clinical practice, and a big focus on that. And it's also to manage the whole nursing portfolio in all our 10 hospitals throughout South Africa,
right,
and including hospitals that we have in Mozambique and Botswana.
So do you conduct any training of nurses yourself?
Yes, I do.
All right, okay.
So currently we actually getting our registration through the South African Nursing Council to have 2 Academy of Learning colleges set up, and I'm very actively involved in the training and development.
Okay. All right. Perhaps at this moment, let's cross over to our Devon studio and invite comment from Professor Bengu, because Professor Bengu, I mean, the South African Nursing Council is the one that licenses training colleges for nursing, isn't that so?
This,
Now,
indeed, yes.
yeah, sorry, carry on.
Okay, we license nurses to practice in South Africa because we have to make sure they are safe practitioners to nurse our public. Now, in terms of what you have just referred to, that is the training has been reduced, the numbers. Indeed, yes, there was rationalization of colleges somewhere in the 80s, which is like, it was more of a measure of certain colleges, like it happened with universities for rationalization purposes. If I may just give an example, if you would know one, like in KZN, we have one college now made of campuses, and one of the campuses which used to train general nurses is now only training post-basic nurses, and so that is minus the undergraduate training in nursing, and many other colleges also were involved in the same way, and so that could have contributed to the shortage of nurses. At the same time, the other thing is that nurses were actually put in posts, especially in the government sector for training. They used to be placed into nursing assistant posts, and the posts, because they are paid salaries, that can only be limited by the financial constraints.
Yeah. Now,
otherwise, the Nursing Council as such does determine also the numbers in the sense that the nurses are doing a practical course. It's a practical course, and they have to get experience from hospitals. And the hospitals need not be overcrowded, so we have to be sure that when they train, they have enough opportunities to train in the hospital. With the shortage of nurses as such, then that becomes worse. So the council, its role is to make sure that the nurses are exposed adequately to enough mentors in hospital, and
okay,
hence the numbers that are determined.
All right, we'll come back to that issue, but for now, it appears that we have a caller on the line, and it's Mujalifa from Northwest. Good morning, Mujalifa.
Good morning, how are you?
Good.
I'm very well. So actually my question was directed to the Acting General Secretary of DINOSA in pertaining to the shortage of nurses that he was alluding to.
Yeah.
I'm actually a newly qualified nurse. I qualified last year on 2014 May. But as I'm speaking, I'm unemployed. So I'd fail to understand when she's saying there's shortage of nurses. How do you take nurses to school and then at the same time they sit home with that particular qualification, with that comprehensive diploma, without job?
All
the
right.
other thing, the other one is directed to the chairperson of the nursing council.
Yeah.
I qualify. I commenced my community service on the 1st of May 2014, and then I only got my certificate in February 2015 to be recognized as a community service practitioner. So that particular thing is also affecting us as nurses.
All right.
Well.
Okay. Thank you very much for your questions. We'll try and get some responses, perhaps. Let's start with you, Dr. Makanya. And maybe just to also put a perspective on the question, you know. It was recently reported, I think about a day ago, from the MEC of Health in KZN, that in fact, you know, there's 28 private nursing colleges that produce somewhere around 6,000 graduates a year, which all of them cannot be absorbed into the system. Now, there's a lot of question marks around this to say, why is it that on the one hand we're saying that there's such shortage of nurses, and then yet we have private nursing colleges that produce so many graduates that cannot be absorbed into the system, fingers pointing at, you know, things such as quality of training at these institutions. Your comment, please.
The mismatch between production and supply for nursing is a long-standing problem, and it emanates from the fact that with the with the transformation and restructuring of broader education sector, nursing education was left behind. And instead of being organized, controlled, financed, and managed like any other educational program, the responsibility for nursing was left with provincial departments of health and not with the National Ministry of Health. And as a result, there's been inconsistencies across the board in terms of numbers that goes into training, programs for absorbing them into when they complete their training. But we are looking into correcting that situation.
So I mean, so the issue that we have a shortage of nurses when there's reports of people that have qualified but are unemployed, it's something that obviously needs to be corrected, isn't that so?
It has to be corrected, and one of the mechanisms is to actually developing a proper human resource for health plan that addresses the intake, the training, and the placement on completion of training.
Okay.
And our steps are quite ahead in actually establishing that, so that we do not have the problems that are similar to the one that the caller highlighted, where production exceed absorption in terms of public sector employment.
All right. We'll get back to you, Professor Bengo, because you know, there was a question directed at you. But at this moment, we have a caller on the line, Victor from Mafikeng. Good morning, Victor.
How are you, sir?
Yes, your question or comment quickly, please.
Yeah, my question is, what is the panel doing with the nurses that are going outside the country, flocking to other countries for greener pastures?
Right.
And most important, the salary.
Okay, all right. So basically your worry is that we have nurses, some of them leave the country, and that some of them are poorly paid, for lack of a better way of putting it. Before I come to you, I know I need to give you an opportunity. Let's get a response from Professor Bengo. Professor Bengo, you heard the question from the caller.
Dr. Mutlaung, in terms of the processing of certificates with the South African Nursing Council, there are standard operating procedures that are followed, but it also not the council alone that's involved. The nursing schools have to send the documentation to the council. I wouldn't be sure at my level exactly where the delay is, but I know I have had inquiries also, and I have asked the person in charge, the manager in charge, to actually indicate the standards operating procedure, which does indicate that it should take about 2 months to get a certificate. But again, it did, in the inquiries that I've had, it did appear that sometimes there's usually a break in communication between the Nursing Council and the schools in terms of documentation that's being processed.
Okay.
Now, in terms of solution of that,
Yeah, all right, okay. So, sorry to interrupt you there. Before we take a caller, we have a caller on the line, but you want to just comment quickly on the standard and quality of training in the private sector in this instance.
I think the standard of quality and training in the private sector is of an extreme high quality because there's a lot of controls and checks in place. And I think the big focus is a lot on the clinical practice. There are opportunities of improvements and there are major challenges. But I think what the key concept here is around how do we improve the quality of lives of South Africans. And training and development is one thing. The other key factor is the competencies of staff. So you mentioned earlier there was about 6,000 nurses. But were they enrolled nurses? What category of nurses were they? So we face a lot of skill shortages where we're going to focus our attention on the specialized skills like intensive care nursing, trauma nursing, neonatal nursing. And it's about going back and bringing the nurse back into the bedside in terms of the clinical competencies. And we have a really good, innovative and creative strategy in place in order to deliver that.
And I mean, you mentioned different categories of nursing. What do you guys train? There's forensic nursing, for instance. Do you get involved in such?
Yes. So not on the forensic nursing stuff, because I think in our hospitals, we'll have to look at the categories that we place into our various hospitals. So in terms of enrolled nurses, staff nurses, professional nurses, advanced midwives, critical care, trauma nurses, and the other softer skills. Sometimes we focus a lot on the training aspects in terms of the academia, but we forget about the communication skills, the softer issues that come out, and that needs and the use of information technology in the nursing profession.
All right. Okay. Let's take a call from at this point. Danny from Vereeniging. Good morning, Danny.
Oh.
Hello, Danny. Are you there? All right. Danny isn't there. All right. I think at this point, let's take a break because there's quite a lot of other issues that we need to get onto. Now, the question now is nursing still regarded by many as a respected and noble profession? Well, we'll find out after the break. Please stay with us.
That goal was outstanding.
Made so much dust that I couldn't see and I hit a stone and we had a puncture.
Catch all these and more every day on Sports Live at 8:30 p.m. on the SABC News Channel.
Zoom into Africa. This is Kenya. The president is Mr. Uhuru Kenyatta. Kenya got independent from the United Kingdom on 12 December 1963. The population is more than 42 million people. One of the major languages spoken is English. Monetary unit is Kenya shilling.
Nurses play a vital role in caring for individuals of all ages, families, groups and communities, sick or well, and in all settings. These include the promotion of health, the prevention of illness, and the care of ill, disabled and dying people.
Unable to
to take care of them holistically. Children, the ability of them to respond to the illnesses is fascinating. You know, children, when they are sick, they are sick. They cannot pretend to be sick. And you can see when they respond to medication, when they respond to treatment, they just becomes okay.
It is important to have nurses. We play a very important role in this country because we are the ones who are looking after the sick. When their families don't know what to do with them, they come to us and to seek for help, and we give them that care and love and help them with all that they need. So it is important. I'm actually glad that there is a day that is specially dedicated to nurses because it shows that we are appreciated as well. There's a big shortage of nurses in South Africa. So I think improvement in terms of the education system of our country. I think we need lots of infrastructure to meet with the demand because it's not like they're training less nurses these days. You find that it's the same number, but it's not enough to meet with the demand, the current demand that we have in our country.
I think the hospital must really improve on the system of opening files. It just takes too long. I mean, for one patient, you sit there for more than 30 minutes just to open a file, and there's only one person working. The rest of the people, we see them sitting on the phone, so we're not sure what is going on, and I don't think it's fair for patients. Doctors were very quick, sisters were very quick, but administration is really bad.
Service we're getting here is not to say it's bad, but it's not too good. At least they can do it a little bit better. Because you're waiting too long in the queues for somebody to come and help you. You're waiting too long to wait and see a doctor. You see, they can speed it up a bit, but otherwise the service is good.
I-right care la abafani abusista bala ngayo yonke indawo abantu bangafani abafani khona ba kind khona banjani.
Right. Now, upon starting official duties soon after qualification, nurses take the following pledge. Now, it says, I solemnly pledge myself to service of humanity and will endeavor to practice my profession with conscience and with dignity. I will maintain by all means in my power the honor and noble tradition of my profession. The total health of my patients will be my first consideration. I will hold in confidence all personal matters coming to my knowledge. I will not permit consideration of religion, nationality, race, or social standing to intervene between my duty and my patient. I will maintain the utmost respect for human life. I will make these promises solemnly, freely, and upon my honor. But the question is, with all these challenges facing nurses today, are nurses still able to live up to this pledge? Well, let's find out from our guests. In our Joburg studio, we still have Maditapo Masemula, Acting General Secretary of DINOSA, and we're now joined by Sister Jolene Fenyana, Trauma and Emergency Sister from Charlotte Maxeke Hospital. Sister Fenyana, welcome to Health Talk.
Welcome.
Welcome back, Maditapo. Okay. Now, we're talking about nursing care now. You know, I mean, before let's face it. The profession has taken quite a bit of a dent, quite a bit of denting over time. Why is that?
It has taken the dent, of course, not forgetting the load of patients that are now coming to our healthcare facilities.
Yeah.
The nurses that are out there, they cannot cope with the volume of patients coming to the institutions. Remember, the infrastructure by then, previous years, it was accommodating so much. But now the number of patients that are out there coming to the facilities, we don't have the adequate infrastructure to accommodate them, much as that is why you will find in the emergency department, emergency room departments. There are so many that we cannot even have the stretchers to put them. We don't have the rooms, additional rooms to put them. That is the challenge that we're having.
Maritap, I hear what you're saying about the load of patients, but do all these challenges have an impact on the ability of nurses to hold that pledge true?
I think holding the pledge true, I think most nurses are still doing that, because what is coming out there is not an issue that nurses are divulging what patients are telling them. I think the key challenges are that based on challenges that you find, like for instance the disease burden and the shortages that you talked about, and when you talk about shortages, we also talk about, you'll find that there might be nurses out there, but there might not be funded posts. But the key challenge is when you find that you are only one. I'll give an example. Working in a midwifery ward, being only one. The chances of one committing omissions or mistakes are very high. If you find that you are supposed to juggle yourself around to manage the ward. That's what we are talking about. But the other issue is that, you know, nurses, especially at rural areas where there are clinics, work under very difficult circumstances where you find that a registered nurse has to find herself in an ethical conflict where you don't know whether you are supposed to assist a person with a gunshot or a person that is delivering. And those are challenges that nurses are faced with on a day-to-day basis, that communities out there need to acknowledge and be very vocal about, especially when clinics are being built to say, explain to us whether there's also planning for health or human resources. So those are the key challenges. But what I can say is that nurses are trying their best under difficult circumstances, and as long as positive practice environment is being practiced, where nurses find themselves in conducive areas where they can discharge their functions without fear or favor, then we can see quality of services in this country.
All right. Let's take a call from Durban and Nkosinati. Welcome to Health Talk, Nkosinati.
Hello.
Yes, your question or comment, please.
My question is I'm having a problem here. We are talking about shortage of nurses in the hospital, but if I can direct to Sister Masemola, what are they doing about employing nurses? Because I got my wife who completed his studies on 2011 is still staying at home, not working.
All right. Okay. Thank you, Nkosinati. We'll address that question. Well, it was directed at you,
yes,
Maritap.
It looks like everything is directed at me. Okay. I think what the callers must understand is that the issue of how a health institution is being resourced is the responsibility of the employer. And as a trade union, what we need to do is to ensure that when people are trained and they come to us and they are members, we ensure that we find them proper employment, and to ensure that the conditions under which they are working are there. But I think also people must also understand, I talked about funded posts. People is what the chief nursing officer was talking about. You'll find that production is very high, but the type of people that have been produced is not the people that are actually needed in specific institutions. So it's very important that with our HR plan, we need to understand to say, based on our aging population of nurses, who are the key skilled people or specialties that we are supposed to start producing for, and so that in future we don't find ourselves producing people that we can't utilize.
Okay, let's get a perspective from the Nursing Council and go over to Devon. Professor Bengu, you've heard the discussion around these issues, and really two issues. One is the quality of nursing care, and the other one is obviously all these challenges that nurses are facing with regards to different levels of nurses and whether or not they are evenly distributed to a point where at least they are able to deliver their on their duties optimally. Your comment, please.
I concur with my colleagues there that yes, there is no balance between production and the demand, especially with the lower categories. who are produced in most of the private schools, we will find that in public sector, they determine the needs for the nurses that they need, and they train their own nurses, as the MEC for Health in KZN indicated. And now with the other sector, the private sector, and I would like to differentiate in the private sector, because there are those that belong to the hospital groups, and there are those that are individual private sectors. Now, the private groups also have hospitals that determine their own needs. However, the other schools, the individual private schools, or independent private schools, do not determine the needs, but it does seem that the profit is one of the motivation for training, and that causes the imbalance.
Yeah. But Professor Bengo, shouldn't there be a uniform system? I mean, from the Nursing Council's point of view, shouldn't there be a uniform accreditation system to ensure that every training college, whether it's private or public, at least adheres to a set a set of standards?
Indeed, that is done. It's been done for a long time, ever since the Nursing Council existed. Accreditation is being done of all institutions that want to conduct training, including the facilities, the clinical facilities where they are allocated for practical experience. They are all accredited and approved as they meet the criteria. And the criteria are well determined and known by everybody. However, we, since there have been such an outcry about quality, we then thought maybe we need to bring on board the people, the experts in education, and that is why we are talking about fitting the nursing education into the mainstream. However, to start with, we think just to get the Council for Higher Education ensuring quality by also accrediting in collaboration with the Nursing Council, probably something can be achieved. And that should start by, in fact, we've already started by the accreditation in collaboration with the Council for Higher Education.
All right, okay. Unfortunately, we have so little time now. We have to go for a quick commercial break and talk about, and I guess answer the question, what does the future hold for nursing in South Africa? Well, that and more after the break.
Welcome to Network, a technology news program that also discusses what's trending in social media in and around Africa. MTN has launched its new movie and television streaming service, Front Row. If it's trending, we will find it. That's Network with me, Spumelele Zondi, every Sunday at 7:30 p.m. only on the SABC News Channel.
Okay, now having discussed the current challenges facing the nursing profession, where do we go from here? How can we tackle all these challenges? Well, let's hear from our guests. We welcome back Dr. Makanya, and we still have Maditapo Masemola, I beg your pardon. And of course, in our Durban studios, we still have Professor Busisiwe Bengo. Now, let's start with you, Dr. Makanya. Let's look at training issues. Clearly, there's problems in training issues. Going forward now, how can we ensure that all of these things are, addressed?
The issue of training and all other challenges facing the nursing profession has been consolidated in the strategy for nursing education and training, which was adopted and is being implemented. Since 2004, when I came into the office, I developed the program of action for operationalization of the nursing strategy. And key among those is the focus on education. Education, there are 3 elements that we are working on. Firstly, the infrastructure program in terms of strengthening our colleges. Like you say, that they've been dilapidated and neglected for quite some time. From 2010, there's been major injection into developing the infrastructure, particularly the college sector, in addition to the broader revitalization project of the department. And secondly, the other sector that has been mainly neglected is the teachers of nurses. Those people have been neglected in terms of their own training, capacity development, and we have recently concluded an audit which actually gives us a sense of the kind of capacity that they have so that they can be able to train for relevance and develop nurses that are both career focused and service oriented, so that they are able to meet the demand for nursing.
Yeah, but I mean, all these strategies haven't been implemented over a period of time. Is there progress? Are we making any progress in that regard?
We are making progress in the sense that the strategy, like I said, that we are at the quite an advanced stage of actually developing the national nursing policy that would ensure consistency and coordination across the country in terms of how nursing education is financed. Currently, it's the responsibilities of the provinces, and unless it's financed like any other education program, instead of putting people in post when they are in learning situation and get their learning compromised. So we're looking into standardizing that. We're also looking into enhancing the clinical learning environment for nurses, because if we want to take it back to the backside, the very clinical component need to be quite efficient.
Okay. I think
the other thing that needs to be appreciated, which we thank the department for having done, is to appoint Uses Jabu as the Chief Nursing Officer, because the key function that she's supposed to be doing is to coordinate nursing at a national level, give us direction as the profession to say what are going to be the outputs that are supposed to be there, what are processes that are supposed to be taking place within the nursing profession. I think that's very, very critical. Remember, at the present juncture, she's just new in the office. And what is the challenge is that everybody everywhere is doing their little thing there. And that is causing problems. And as long as nursing can be properly coordinated, then we can see ourselves going forward as a profession.
We've run out of time, but let's invite from our Devon studio, Professor Bongi, to get your last word on the way forward. Professor Bengu?
Well, in as far as the Nursing Council is concerned, is to beef up accreditation involving the Council for Higher Education. Secondly, we are sourcing funds to begin to conduct board exams, because the nursing schools conduct their own individual exams, and one is not sure whether they are at par with everyone in terms of quality.
All right. Well, I'm afraid, we've had so much to talk about and so little time. And Professor Bengu, Dr. Makanya, Maditapo Masimula, thank you very much for your contribution. Folks, it's on that note that we come to the end of our show today. And your views and comments are extremely valuable to us. Please share these on Facebook by going to SABC Health Talk and like our page. And follow us on Twitter at SABC Health Talk. Send us an email at healthtalk@sabc.co.za. Join us again next week on SABC News. And remember, you can watch the repeat shows at 2 p.m. and 10 p.m. tonight. And go to our SABC YouTube link if you've missed any of the shows. So from myself, Dr. Salom Daung, and the rest of the crew here, thank you very much for watching this show, and please do take care.